President Joe Biden announced the federal government will double the amount of rapid at-home tests. 1 billion tests will be distributed to Americans for free. The government is also adding high-quality face masks.
Omicron variant is causing millions of cases and record hospitalizations. I've been saying that as we remain in this pandemic. This is a pandemic of the unvaccinated.
Let's get an update on how things are looking in our area. Dr. Brad Burmeister with Bellin Health joins us now live via Skype. Doctor, thanks so much for being with us this morning.
Good morning.
Now, Wisconsin reported another daily record for new cases. More than 13,000 were confirmed Wednesday. How are we doing locally?
I think people will not be surprised to hear that we continue to operate over capacity. We have more patients seeking healthcare in our health systems than our health system really was designed to handle. We've tried multiple different things to try to ease that burden and the stress on our systems by, opening more space in our health system. Here at Bellin, we had a NICU that had been under construction for a while that had just opened, that we are able to use some rooms for babies and some rooms for adults who are not infected with COVID, obviously, to help get that extra space everywhere we can, to help keep people moving through the system and get the care that they need.
And President Joe Biden continues to say this is a pandemic of the unvaccinated. What symptoms are your recent patients experiencing? And is there a difference between vaccinated and unvaccinated people?
Right. So we see a clear disproportionate impact of COVID-19 on people who are unvaccinated at this point. We expect, maybe today or probably before Monday, that we'll get an update from the state of Wisconsin on how the vaccine has performed from data in December. This will be interesting because this is really the first time period where the Omicron variant has had a significant impact on us. But I think that our frontline experience in emergency departments is that the vaccine continues to have, really significant and tremendous benefits to patients. It not only decreases your likelihood of getting COVID in the first place, but if you do get COVID, it has a significant impact on keeping you out of the hospital. And, if you end up needing to be hospitalized, it helps you have a shorter hospital stay and, has a really helpful impact on preventing you from dying. So the people who are vaccinated at this point are having an experience right now that's probably much more towards normal than unvaccinated people who remain at significant risk from COVID-19.
Now, it's taking many people several days to schedule a COVID-19 test. What should someone do during that time? And if they're not showing any symptoms, is it safe for them to go out in public?
Two great questions. First, we know that individuals who are seeking a test are having a hard time right now getting that test done. There seems to be, a very, very high demand for testing right now, and people just cannot get scheduled when they want to get scheduled for that test. If you are having a challenging time getting scheduled for a test, we would recommend that you stay at home because, we don't want to be infecting other people. And probably one of our biggest asks is that you don't seek emergency care unless you feel that you need it. If you are having mild respiratory symptoms, home management would be sufficient. If you present to an emergency department, really by federal law, you are required to see a healthcare provider who can do a physical exam on you. You can't just come to an emergency room and get a test because federal law does not permit that. Emergency rooms are really for emergencies.
Yeah. Now, doctor, it's been recommended that people get rid of the cloth masks in favor of N95 or medical grade masks because of the Omicron variant. Can you wear a single-use mask multiple times, and how long can you wear it and still protect yourself from COVID-19?
Yeah, I think not much has changed on mask efficacy or how well they work. I think, if people have a cloth mask available and don't have another mask, that is clearly at this point more helpful than no mask at all. If though you have the means to have a mask that's more effective, either a typical surgical mask or a KN95 or an N95, if you do have those are more effective as you get to the more advanced masks. As far as how many times you can use them, they likely can be used multiple times and have the same degree of effectiveness. typically these masks are designed to be worn once and disposed of. But I think with the demand for masks in the world right now, that clearly is not something that's realistic for us to have that sort of number of masks that are made. So I personally use a surgical mask when I'm out in the community, and I do reuse it. Sometimes that ends up to be a couple of days, but it sort of depends on what sort of supply is made available. Do I have extras at home? Or sometimes I use one from work that I take home with me.
Now, there are new oral pills to help with COVID-19. Can you tell us more about those?
Yeah, absolutely. So, there was a lot of optimism on these oral pills, particularly early on. I think our experience now is first that the supply chain or the availability of these is very restricted at this point. And there's a very narrow number of people that these medications will work well for. First, they need to be given really early in the course of disease, certainly within the first 5 days of symptoms. Second, they seem to interact with a lot of medications. So people who are most at risk from COVID-19 typically end up being older individuals. And as people probably know, the older you get, the more medicines you seem to be on. So there's some challenge there in actually using these medications for people who are likely to benefit from them most. And then also, we don't want to use these in anyone who's pregnant or at risk of becoming pregnant in the near future, because they have been shown in animal studies to be harmful to fetal development. So a very narrow window of eligibility for these. Clearly, again, vaccine is the most effective thing that we can do to help prevent people from getting sick in the first place. But, it is nice to have another tool in our toolkit to help us continue to navigate this pandemic.
Doctor, how is the hospital managing with the current blood shortage?
That is a great and really important question right now. We know that our blood shortage is worsening. This is largely due to the Omicron variant, as I understand it, where people are less able to go donate blood because they find themselves sick with COVID-19. And, the agencies that collect blood are having staffing shortages as well related to the spread of COVID-19. So right now we have an adequate, though short supply of blood. But, this is something that's really crucial for us to have a good supply of, because when you need it, you typically need it quite emergently. So, if people are out there and they're feeling well, they're feeling healthy, if you have some time to donate blood, right now would be a perfect time to do so, as we really need you.
And doctor, obviously a lot of other illnesses going around right now. Is an uptick in flu cases being seen at Bellin?
Absolutely. For the last several weeks, we've seen an increase in the number of cases of influenza. We are about 4% behind last year's vaccination rate for influenza. So that is another thing that people at home can do to help your health systems and your communities get back towards normal, is to get that flu vaccine. But so far we have not had a significant impact on people needing hospitalization due to influenza so far. And I think very few, if any, deaths have been reported from influenza, despite really robust testing for the virus.